we are part of the healthcare industry, and everyone talks about the changing of healthcare in the United States and actually across the world. There's talk about socialized medicine. There's talk about all these different things that are changing and evolving for lots of reasons. We have our older adult population is growing across the United States and across the world. We have actually fewer people going into healthcare than we did before. And the rising cost of healthcare has changed the opinions of both politicians, people, in the concept that they feel that the money being spent on healthcare is too much. And what that implies is that we as healthcare providers are getting paid more, when the reality of is we're getting paid less and less and less every year that we're in practice. I have never ever seen in this profession a payer actually say, you've done a great job, we're going to pay you more for your services. Whereas the plumber that comes to my house, who's a master plumber, I have to pay him a premium because he does a better job than someone else. It's a very skewed business model that we feel is going to force changes in healthcare, and we see those things coming right now. There's such a thing as executive medicine now, where physicians are now no longer taking insurance, and as a patient, you pay them anywhere from $1,500 to $2,000 up front a year, and he has a limited group of people that he services, and he only services them, and really you pay nothing else. That he controls his costs, he controls who his clients are, and he or she has found a way to exist in this healthcare environment. Across the board when it comes to healthcare and providers, we also see where there is a centralization, or basically there are large companies taking over, and this happened 20 years ago, where you see hospitals buying practices, and there's a consolidation of healthcare into big entities, feeling that these big entities can actually now compete in a government-based program. And there's also safety in numbers, and a lot of these healthcare companies and providers feel that if they can make big conglomerates, they can now go to payers and say, we are the biggest provider, you have to pay us either a better premium.